Hello, everybody. Thank you for being on time and joining us. We will wait an extra, say, 5 minutes to see if we'll get more people in. But in the meantime, can you please use the chat box to let us know where you're from, what country you're from, and if you are speaking in any preferred language. Just a bit of house rules. Maybe let me start by introducing myself. I'm Lesego Twiler. I'm the GNP Plus Communications Manager, and I'll be moderating the session today. We'll give it a bit of 5 minutes before I introduce my speakers and start the session, just so that we get a bit of an audience. In the meantime, please use the chat to introduce yourself and your country. And for those that are already here, we have translation in 5 languages available to those that need it. We have Arabic, French, Spanish, Portuguese, and Russian. So you can choose a channel that you would like to listen to the session in, and then you'll be catered to. The session today will be conducted in English. Thanks. Namibia, Nepal, good evening. Narayan from Nepal, thank you for joining us. Now it's evening on your side. Francina from Namibia, welcome. And Michael, thank you for joining us. Network of young people, key population in Ghana. From Canada in India, from India right now in Canada. Thank you, Dashini, for joining us. Rene Ford from Zambia, thank you for joining us as well. George, President of the Portuguese LGBTI movement. Thank you so much for joining us. We do have translation in 5 languages, so please feel free to use the channels. Tawanda from Zimbabwe. Hello. Hi, Esu from Senegal. We will start shortly, and the rest of the people can join us, find us in progress. Aline from Brazil. Hello. And Prince from Ghana. Thank you for joining us. Okay. So our 5 minutes grace period is over. We shall begin with our session for today. Just to welcome everybody again. My name is Lesego Twiler, and I'm with GNP Plus as their communications manager. And thank you for joining us for this first of 3 series webinars around which will focus on AIDS 2022, what you need to know, This is our first session because we do understand that communities need to be at the conference, and there might be some burning questions that you might have about how do you participate, how do you get there, but also if you can't get there, how do you still engage with the conference. So today the session will be about that, where we answer all your questions. We have people today who made time to come and answer all the questions that we have around the conference. But just for some house rules, we do have a Q&A box where you can post your questions live and they will be answered live. We have a few set questions that we're going to be starting the discussions with. And if nothing from these questions were not answered, you're more than welcome to use the Q&A section to ask your questions and we will get to them. The session today will be conducted in English, but we do have translation in 5 languages. If you click on the globe sign at the bottom on your right-hand side, there is a globe sign where you can choose which channel you want to listen to, and there will be somebody there translating the session for you. And the session today, as you may see, we won't be having any presentation. We don't want to have another boring webinar with presentation and nothing else. So it will be conducted in a Q&A style where our 2 speakers will be, I'll be engaging with our 2 speakers, asking them questions around the conference and what, as communities of people living with HIV and key population, what can we expect? How can we get there? And all those other burning questions. So just to introduce my first speaker and guest today. It's Ariane Brusselsman from International Society for AIDS, IAS. They are the conference director at IAS. Ariane, thank you so much for joining.
Thank you very much for inviting, and very nice to see so many people from all around the globe. So I'm Ariane, I'm originally from Brussels, from Belgium. But I work for the International AIDS Society in Geneva, Switzerland. So very happy to see you all, and hopefully I will be able to answer all of your burning questions about the AIDS conference in Canada.
Thank you for joining us, Ariane. And then at the later stage, we will have Alain. Alain, if you could introduce yourself.
Hi, everyone. My name is Alain Chendukwa, and I work with Y+ Global. Excited to chat with you this evening or morning, depending on where you are. Thank you, Leslie.
Thank you so much. Okay, so we'll start with Ariane. Ariane, I'm going to be posing a few questions to you about the conference. I think for us, firstly, would be to just tell us about the AIDS 2022 this year. It's in Canada, and I think one of the questions that people might have is why Canada? It's such a difficult country to get to for communities, but why Canada? I mean, we know the past one in 2020 was in San Francisco, and unfortunately it had to be cancelled because of COVID. What's different this year with this conference? Yeah, if you can just tell us more about that.
Yeah, I can tell you perhaps a little bit more also about the whole crazy times like everyone we've been going through with the 2 past years of events being turned into virtual, and then we're very excited to go to Canada and to meet the community again. But it's true that in a conference cycle, you have to know that pre-COVID, it takes like 4 years to organize a conference from the day that you actually start the bidding process and start selecting cities and until you have the event. And obviously COVID has turned that completely upside down for us. And why Canada? Canada had been selected previously for a conference, and due to COVID we had to change our decision making, and we decided to Canada because it was very convenient for us. There was a very good conference center, a very professional team within the venue and within Tourism Montreal. So that was the decision making behind Canada. Canada is the 4th time that an AIDS conference is returning to Canada. And in a way, our team is to re-engage the community, and it's a nice way to bring it back because, as you may know, that Canada, the first time we came to Montreal was in '89, and it was the first time that actually activism took a central stage in the AIDS conference. So in a way, we're coming back now after 3-4 years of no conference or virtual conference, and we're very happy, and we really hope that activism will be and the presence of communities will be a very important part in Montreal.
Great. I think, Ariane, one of the questions I think, or maybe the issue that has been coming up is with regards to visa application and the visa process. You know, I mean, a lot of communities come from the global south, and, you know, getting visas might be a bit difficult and all that. What are those things that are put in place by the IAS to make sure that visa process for communities run smoothly, or what any other issues that they come across is dealt with?
Yeah, that's a very good question, and it's true that Canada is not the easiest country for immigration purposes. But what we have done at IAS at a very early stage, we have started talking to the immigration services in Canada, and they know, all immigration services, consulate and embassies all over the world do know that there is the AIDS conference, and whenever you register, you receive a letter where you do have a code that our conference is registered through a code in the immigration system. So you have to make sure that you actually put that code when you apply for visa, because then there is an expedited process for visa application. We also have a dedicated email address in case there's some issues. Obviously, we have had some issues. We have had some people who had issues, and that's because we cannot control the people who are actually making the assessments. But to put all the chances for you, it's really to use that code and to apply online for a visa.
Okay, so people shouldn't share codes. We shouldn't be sharing codes with our friends. They will block you. Okay, so don't share codes. So each code is specific for an individual. So that code is like a unique identifier to say, this is you have been accepted to come to the conference, and this is what you must use.
Yeah, the code that the registration letter that is put on the registration letter is very important. Another point that you may want to consider is also what is important for the authorities. What we've been asking and back and forth with them is really to give a very good reason why you are going back to your own country, because that's sometimes a stumbling block.
Okay, so the going back to your country is very important.
Yeah,
you need to show. Okay, great. I think that's understandable, because it is a kind of difficult situation when you are being denied, you know, a visa, and you're looking forward to be at the conference. So, I mean, the conference is such a big thing, and I know communities would have by now submitted abstracts, submitted sessions, and some of those have been accepted and some of those have been denied. But can you tell us a bit about how many abstracts were accepted, and how big was the pool of abstract that people had to go through to make sure that the selected ones are there, so that people can know that how the process went, and, you know, they can be made feel better about maybe their process, their abstract not being accepted.
Yeah, absolutely. So the abstract process is a very competitive process. Just to give you some numbers, we have had almost 7,000 abstract submissions. The process happened between the end of last year and March. And then there's a whole committee that is selecting the abstract, and we did select around 1,400 abstracts to be presented at the conference through oral abstract session, poster session. So as you can see by the numbers, it's a very competitive process. And we make sure that there's also a very big community involvement there. We have around, I think, 45% of community-led abstracts, and obviously I'm aware that, you know, it's quite disappointing when you submit an abstract and you're not selected, but the only thing I can say is keep trying, continue trying. We also have to help you write better abstracts and have more chances to succeed. We have an abstract mentor program for each AIDS conference, where you can apply, and you have people who are helping you to make sure that your abstract has the best chance to go through.
Yeah, I think those processes were there, and I think some people did take advantage of those opportunities for abstract writing and all that. So that's great to know that that option is available there, even though the abstract now has been closed. But like, what are some of the sessions that we can look forward to, some of those exciting workshops and sessions that were accepted that communities can be excited about at this year's conference?
So we have a number of different types of sessions. We have high-level sessions, we have symposia sessions, oral abstracts, and all of those have been published on the online program. I don't know if you have had a chance to look at it, but there's an enormous amount of information there. But in terms of you want to know about the abstract sessions or about the high levels, or
high level, some of the high level sessions, I mean, the symposiums, I mean, I know that people should look forward to the GNP Plus and ICW and Y Plus symposium, but that's besides the point. What are some of those other ones that are like exciting high levels that our communities can get really excited about to keep track on and just, you know, make sure that they keep a watchful eye, and when they're there, for those attending, can be able to attend?
Yeah, so we have a number of high-level sessions. We have obviously the opening and the closing session will hopefully feature some high-level people. We will have from the community in the opening session, Tim McCaskill, who will be present, delivering the opening. We're still hoping to have the Prime Minister, Justin Trudeau, in the opening session as well. We will have some very nice entertainment as well in the opening that I won't divulge too much because that's going to be a surprise. Both in the opening and in the closing, we will have some very nice musical performance, 100% Canadian, to look forward to. Then in terms of the sessions, we will have, just to name a few that may interest you, we will have a session, a high-level one on Indigenous responses to HIV and the opioid epidemic. As one of the main speakers that we'll have there is Doris Pelletier. Then we will have one also in the context of the conflict in Ukraine, but not only. We have added a high-level session on HIV in armed conflict. We have one on HIV prevention and treatment, where we will have your very own Anna Sango presenting as well. We will have one on strengthening health systems with Rana, and I can never pronounce her surname, Yana Masok, I think, from Thailand, that will be presenting on health system. We will have one on health equity as well, with Fatima Hassan and Greg Gonzalez from Health Justice Initiative in South Africa, Greg Gonzalez from the US, with John Gengas from PEPFAR. We will have one also on maybe that can interest you as well. It's on community engagement in research, where we will have also the Assistant Secretary of Health from the US, Rachel Levine, that will be giving opening remarks. We will have one on drug use and HIV with Michelle Kazakskin. Yeah, so these are just one of the few. There's many others. There's many others and I really encourage you to look at the program, because
to look at the program.
Many.
We will share the program on the chat so that people can get a look at it and to see where they can fit themselves. I mean, there's a question in the chat on the Q&A where somebody is asking if the invitation to attend has already closed and how do one apply to join the conference.
So registrations are still open to attend, so you can still register. You can actually register up until the one day before the conference. So yes, you can still attend, but obviously you will have to be careful about visa application, because it can, depending on where you're from, visa can take up to 3 months. So
yeah, so people need to register as soon as possible if they want to get those visa in there. There's a question there, is there any organization to sponsor the workshop in Canada? Are there any organizations that IS is working with that sponsor workshops for communities and for networks that you know of?
Sponsored as a delegate, you mean? Or I think they mean to sponsor like a workshop. So
somebody wants, because I know that at some point with the conference you buy space, like the workshops you have to pay to host the workshop and things like that. Are there any organizations or partners that are sponsoring these kind of costs?
Well, we have a number of organizations, but unfortunately that process has already been closed. We have we have our own program, but we also do have other organizations who are joining, and we're buying indeed slots for satellites, pre-conferences. So yes, those organizations are sponsoring their own activities, but unfortunately we have a fully booked schedule. We're completely fully booked.
Completely fully booked. Great. Iris, is there a question in Spanish that you would like to pose? Okay, sure. Thank you. Okay, no problem. Please, if you have a question, pose it in the Q&A section so that it can be seen. Otherwise, it might just get lost in the chat box, because when people chat, then it gets lost. But if you put it on the Q&A, then we'll be able to. Yes, that was going to be my next question, to say, for those that I know that the conference is going to be hosted hybrid. So what can people expect in a hybrid conference? Because these are something new for some of us. So what are those things that people can expect, but how can they then attend a hybrid session virtually in their own countries? What kind of support is provided for networks who want to attend virtually as well?
Yeah, so this is actually one of the main challenges we are now having, because it's the first time that IAS is doing a hybrid meeting. Hybrid meaning that we will have all the sessions that will happen in Montreal will also be mirrored on a virtual platform that we're working on now. So that virtual platform is not yet available, but will be a few days before the conference. So if you have registered to the conference, you can either attend in Canada, and you will also have access to the virtual platform, or you can decide, if you know that you cannot attend Canada, to only buy the virtual registration. And with that virtual registration, you will basically have access to all the sessions that will be live streamed on the platform. And obviously that will be available on demand as well after the conference. The only thing that we did not do in a hybrid model are the workshops, because that's very difficult to replicate. So we will have some workshops virtual only, and other workshops that will be in person only. But all the rest, all the content will be available on the virtual platform.
And for those that say can't register or doesn't have the cost to pay for virtual access, after the conference, will this content be available for public view?
Yes, absolutely. So our policy is that we do keep the content for 1 month available on the platform for those who paid, and also for scholarships, if you had a scholarship, obviously. Then for another month, it will be available for IAS members. And then after 3 months, it becomes free. So after the 3rd month, all the content will become publicly available. Okay. Provided, obviously, that the speakers have given their consent to give it away.
Given consent. Okay. It's understandable. There's a question I think in French. Can the French translator please help us translate in the Q&A? They can. But in the meantime, Prince says, with the issues of visas, is there anything the IAS is doing to ensure that embassies expedite the process for delegates? I think you've answered that to say that already the IAS is talking to embassies, yeah?
Yeah, so the immigration services are aware that our conference takes place, and as I said in the letter that you receive when you register, when they see the code of the event, they know that they have to expedite the visa process in your embassy or consulate.
Yeah. So you need to get in touch with your embassy and let them know that you are attending for the IS. And remember, each person has a unique code that is assigned to them as a delegate. So that will help make the process faster. Great. French, Chantal, are you able to see the question in the Q&A?
Yeah.
Yeah, please move to the English channel so that you can read the question in English.
I think the question in French, as I'm speaking French, I can translate, is about is about involving people with HIV in research to eradicate, and that it's quite complicated in Africa. And that's true, and that's why we do have a number of sessions that focus on community. As I said, there's one session on community engagement in research that is key, and I'm sure there's a number of other sessions where that focus on community engagement.
Okay, thank you. That is answered. Prince, we've answered you. And then Ricardo, is it also in French, Ricardo's question? Or is it, I'm sorry.
That's in Spanish, I think.
Spanish. Oh,
there
Iris,
I have some
please.
limitation.
Iris, please help us with the Spanish question from Ricardo. Or what's the cost for virtual participation?
Yeah, so the cost for virtual participation is, there's a number of different costs, and I don't have them on the top of my head, but they're all on the website. We chose to reduce the price by 20% for virtual participation, and it really depends on which country you're coming from, because we have a differentiation between high-income country, low-income country, if you're a student, or so you can look at the website on the registration page, and you can see the different cost options.
Yes, please, Clint, my colleague, has shared the link to the IS and the AIDS conference website. So also look there. I'm sure that you'll find most of the information, like the cost and the things that we don't have on the top of our head. There's another follow-up from Richard. I don't know if it's the same from Ricardo. I don't know if it's the same question, but I see it here. Before we go to Anonymous. It's on the second one from the top. Oh, is it the same one? Okay, thank you so much. So there's an anonymous, my question is with regards to person who have received full scholarship. How do we know where to go when we arrive in Montreal? It's more of a logistical question, but is there a space? Will there be information sent out to scholarship recipients?
Absolutely, you will receive a guideline with, at the moment, we're working on slide bookings and obviously on selecting also accommodation. So you will receive those details as it is closer to the conference. I will need to check with my colleagues working on scholarship the exact date, but obviously we'll receive a guide with all the information you need to know where you're staying, and yeah, a kind of pre-departure guide.
Right. Aline has a question around the delay in receiving invitation letters for registered participants. Who can we contact to speed up the process? I'm sure this is for visa processes, because the time. Is there an email that people can email to for registration letters that are being delayed?
Yes, absolutely. There is a registration at AIDS2022.org. They usually the registration team does answer in less than 1 day for the registration letter. But if you have delays, don't hesitate to send a message, because they're usually answered relatively quickly. So if you have a delay, maybe it is that there's something in the system that didn't go through. So yes, I would encourage you to send an email to the registration desk.
There's a question here about, are there any specific sessions that are specifically designed for Caribbean? I think maybe look at the program. I don't know, is there any Caribbean sessions, Ariane, that you know of that are specifically for that?
Not that I know, because we tend at the AIDS conference to focus really on the global issues. There certainly maybe are some speakers from the Caribbean, and again, I don't know from the top of my head because we have more than 300 speakers. But yeah, in general, we don't focus on specific regions in our sessions, but we tend to elevate the global issues.
Global issues. And somebody's asking how many networking zones are there and that are available at the AIDS conference this year? The networking zones, how many are there?
Networking zones. Let me check that.
Sorry, Sophie, can you hear? You can't hear us or me or Ariane, maybe, or are you in the right channel? Because Sophie says they can hear. Just to check if they're in the right channel. But we know that, just so that while Ariane is still looking, there are a few networking zone, and there's a people living with HIV networking zone. I know that there's a sex worker networking zone. There's probably a key population networking zone, and I think the women's networking zone has just been accepted as well. Young people. So there's several.
There's several. I know in the Global Village we have we have around, I'm just trying to find the info because I don't have them all on my.
But the one that's more important, that people living with HIV networking zone is there. And we have a call out for sessions. If you don't have any space for hosting workshops at the Global Village and the networking zone, look out for a call on the GNP Plus, ICW or Y Plus networks, social media networks. We put out a call for people to apply to be able to use the space if they wish to. So. And I know the women's networking zone that will be run between ICW and other women's networks, it's also there, and the young people networking zone. So please get in touch with our different social media networks and just to be able to be included in those sessions.
Yeah, there are more than 20 networking zones that are actually available also now. The Global Village program has been published since yesterday, so you can also see everything, all the NGO booths, the sessions, and the networking zone. So more than 25.
Yeah, more than 25. That's a lot. So the main stage for the Global Village, is that closed? Is that closed for registration for people to suggest any sessions there? Oh, is there still opportunity?
So that's also a process that we closed, also a highly competitive process. We have 162 activities between all the NGO booths and the sessions and film screenings and NGO booths. And we had more than 600 applications there as well. Yes, this is unfortunately closed. So I think the best way to do it is really to get close to your organizations that may already have an activity organized there, and see, if you could, if you could work together.
Coordinate with that.
Yeah,
great. That's great. And then Prince says the program looks packed. It is packed, Prince. Are attendees supposed to attend all sessions?
Yes, we expect all attendees to attend absolutely all sessions. That's why I think this year the beauty of the hybrid model is that even if you didn't attend all the sessions, you can still watch online if you missed out on any.
So there's a question around the schedule for volunteers. It's more of a logistical, I think, questions around the volunteers, and I don't know if you would have this information about the volunteers. Maybe you do, but I don't know. But if there is an email where people can email to a direct contact around volunteer schedules, maybe you can share that.
So the volunteer schedules, I know the team is working on it at the moment, because we still have some activities where we're really right in the planning of all the volunteer schedules. We have sent out a message of confirmation, so volunteers should know whether they have been selected or not. But we don't have a final planning yet, so that will come.
That will come. That will come, Anonymous. Please watch out for that if you have applied to be a volunteer. And the most important question, I think, of today is, what are the preventative measures against COVID? I mean, we know COVID is still a living reality that we're still living with. So what is IS doing or going to be doing to make sure that people are safe and feel comfortable to be in this space?
Yeah, so this has been, there's been a lot of discussions in the past few weeks actually on what we should do, because as you know, the restrictions have been lifted in Canada, so there's no masking requirement, and yeah, all the restrictions have been lifted. You need 2 vaccines to enter in Canada. So what we decided, and that will be published soon, so a sneak peek, is that we will require mandatory masks in the conference. So that has been a decision that has been taken very recently, and again, that will be published soon. And we will also encourage people to have some auto testing every day or every second day of the conference, and obviously discourage them if they're positive to come into the conference. We don't want to mandate that. We will mandate the mask, but not the testing. Yeah, but that's what we have put in place, and obviously we will also have hydroalcoholic gel available. Throughout the event.
And do you know if Canada has any, like, what's the question, like any preference with what kind of vaccine you have? Because, you know, coming from everywhere in the world, we have different vaccines that we had. Is there any limitation to say if you have this kind of COVID, then you are not allowed, or you should be maybe trying to get this type of COVID to make your entry very easy to Canada, things like that?
Yes, there is. To date, they have the Canadian authorities have accepted 7 or 8 vaccines, I think, that are also on our website, or the link to our website to the vaccines that you need to have. Important to note also is that your vaccine certificate needs to be either in English or French. So that's quite important. If it's not in English or French, that you make sure it's translated.
Make sure that your vaccination. Yeah. So what if you have a handwritten a vaccine certificate that's handwritten? Is that still permissible?
I think as long as it's as it's certified with a stamp from some kind of authority.
Okay, just checking. I mean, some of us come from Africa.
Yeah.
My vaccination certificate is handwritten. It's still a card that's handwritten. We don't have a digital form of like a vaccine certificate. So I'll be bringing my card. So hopefully they don't block me.
Yeah.
Okay, great. Will it be PCR testing available? Because some of us need PCR testing to return. I'm sure you can. I mean, probably will IS, when people are returning home, will they provide a company that they can contact for PCR trainings and all those kind of things?
Yeah, we took the decision not to have the PCR testing in the venue, but we will have a list of pharmacies and centers where you can actually take your PCR.
Where you can take your PCR. And for those that you are already in Canada and you find out you do your testing at your second day and you find out that you are you have COVID, what's the process there? Will you be just expected to stay in your hotel, or will IS provide a space or a room where people can go and watch things live virtually and things like that? You know, so that they still engaging in the conference?
Yeah, the conference, as it will be hybrid, and if you have your registration, you will be able to watch the conference from your computer.
Okay.
Yeah.
Okay, great. Will there be an opportunity for voluntary HIV testing at booths during the conference? Do we have any exhibition space or booth space that is being earmarked for HIV testing for people who would like to test at the conference?
That's a very good question, and I do not have the answer to that. I would need to go back to my colleagues. do not think so. But yeah, I don't have the answer to that. I'm sorry.
Yeah, maybe I think, Prince, maybe there will be some organizations or networks, or normally people would come with their testing, maybe a TB HIV care would be testing at their booths or networking zone. We must just watch out while we are there to see if there is any of these type of opportunities to do, to test. I think, did we answer all the questions? Oh, there's another question coming in. I think it's in Spanish. Is it in Spanish or? Iris, you have your, Iris, you have a lot of work to do today. Another Spanish question, please. Treatment at the conference. Okay, yeah, maybe. Oh, so maybe for those, yeah. So will there be opportunities for those that maybe your treatment gets finished while you were at the conference? You didn't bring enough. Will there be any spaces where are there any organization in Canada locally that could provide these medication for delegates who might not have, or sometimes when you travel, they might take it, confiscate it because it's not labeled or things like that. But what are those measures that are put in place for people to get medication?
We don't have specific measures, but we do have a medical center. Within the event, we have two actually, in the Global Village and in the main conference, with some supplies, and we're working together with the university hospital. So I can, indeed, that's a good point. I can ask them whether they could have some supplies available. Yeah, in the infirmary.
Okay, great. That's amazing. So there's a question to say, will one who has a general registration be allowed to enter sessions at the pre-conference? Does your registration for the IS allow you access to a pre-conference that is organized?
Yes, absolutely. Your pass gives you access to all pre-conferences, except if the pre-conferences has been it's a closed meeting, and to my knowledge, there's only one that is an invitation-only meeting.
Okay, which is? Do you know
the one of PEPFAR?
PEPFAR's one is by invitation.
Yeah.
Okay, but in all the other pre-conferences, you can use your registration to attend.
Mm-hmm.
Great. I think we'll take one last question. I think it's also, is it in Portuguese again? No, it's in Spanish. It's in Spanish, and then big question. Why
I
don't
think it's a big question.
It is. I mean, I guess, yeah. It is a big question, and I think it's one that needs the policymakers and all the people up there to say, and the pharmaceuticals, why do you have a vaccine in 6 months but not in 40 years? It's a good question, because it has been 40 years since the first diagnosis of HIV. So it's something that we need to be taking as an advocacy message to the conference if you are going. And I think that's something that we can take through to the conference when we're there to say why, and ask these questions to the leaders that are going to be at the conference, and to be direct with them to say, if you can do this in 6 months, why can't you do it for HIV? So I think you must hang on to that question, and let's take it to the conference. And also just to remember, the second series session, the second webinar that we will have in July will be around advocacy messaging. So this is a space where we can then have these brainstorming session around the advocacy messaging that we want to take to the conference as PLHIV. So great that we're starting now, but let's hold on to it. And for the next sessions, let's come with these advocacy messaging that we want to go with to the conference, and question the leaders, because we will have them in a space. They don't have anywhere to run. Wow, we will all be there.
Yeah, absolutely. I think it's an excellent question because that's the raison d'être of our conference. That's why we organize those conferences, to answer those big questions, because
Exactly.
that's where we gather policy, community, and scientists together.
Together, yes. So we will ask them at the conference. Next webinar, please join again so that we can really talk about these advocacy messaging and really define them and take them to the conference. But thank you for your question. Maybe the two last questions is there organization covering flights, accommodation? Are there organizations, independent organizations besides IAS, because I know IAS has given scholarships already, but are there other partners that have come forward to say we are willing to cover people's flights and accommodation, knowing that Canada is very expensive?
There was a Canadian research organization that also provided for scholarships, but they have unfortunately also closed already their application. So no, not anymore, unfortunately.
But yeah, I would suggest maybe, Francina, to look into these organizations. Sometimes there's some organization, if you contact them individually or write them a letter, might be able to have some resources to cover other people and activists. So it would be good to do your research and just to look around. Is there a UNH that's covering? Is it a thing, you know, just to see what's out there? Or your local organization sometimes might be able to support you if they do have the funds. But otherwise, virtual is also there. So don't just aim to go to Canada, aim to also attend the conference virtually and make sure that, because the space is already there and it's provided. Any ideas for first-time conference attendees? What can they expect? And I mean, they're going very far to Canada. What are those tips that we have for first-time conference attendees and travelers?
It's a good question. It will be also my first AIDS conference, so I might not be the best person to have the tips. But yeah. I think you can expect from what I hear from my colleagues, something like you've never experienced before. I've done a lot of medical conferences, but while I'm organizing this one, I really see, I think there will be a lot of festive activities, a lot of colors, a lot of people disagreeing with each other, but also agreeing with each other. So that's why we're there, and that's why we're all happy to meet all together again. But perhaps someone who has already attended the conference can better answer that question.
I was gonna say maybe in the chat, if somebody has been a regular conference attendee, please give us some tips. Let's share so that people don't have anxieties of going to such a big platform. Thank you, Anonymous, for your question. Okay, I'm taking the last one so that we can also give Alan a space. I have never been to a pre-conference. What can I expect this year? Is it only for the young people? What are the diversity of the pre-conferences? What do we have on the different topics of the pre-conferences this year? Do you know them at the top of your head?
So we have a number of pre-conferences from different organizations. We have one focused on youth, so one pre-conference on youth. We have obviously from PEPFAR. We have some, I think, for Impact as well, a pre-conference. From other NGOs, global NGOs. They will be published soon as well. But yeah, there's many different sessions.
So look out for at the website, because the website has a lot of information. So make sure that you bookmark it and you put it there so that you can check it every day for any updates if you're going. So one last important question, saying I have an IAS scholarship and I have a disability. Will need accommodation for that is for disabled, or that allow people with disability to access it? Is there any accommodation that's being earmarked for people living with disabilities?
Yeah, absolutely. And important that you know that to the scholarship team, we do have accessibility in the venue. That will be published also quite soon on the website on our services. Okay. And but yeah, important to really mention that too. But I'm sure you've already done to the scholarship team.
Yeah, the scholarship team will give you all the information that you need with regards to that. Unfortunately, the scholarship has been closed for now. So now you can't apply for a scholarship. All the scholarship recipients, I think, have been contacted and have been notified whether they've made it or not. And yeah, maybe try again next year. But there is a virtual platform, and like Arian said earlier, that the material, the content will be available to IAS members, but also after 3 months, if you're not an IAS member, it will be open to the public. Will there be an app for the conference so delegate can download a guide on the move? Good question, because it's COVID, pre-COVID. Will there be an app with a program?
There won't be a specific app, but we have the program is fully mobile friendly. So if you go to the website and you look on the program, it will show up like mobile friendly. And we will have a pocket program also, a printed small program. Yeah.
Okay. Great, amazing. And if people want to input, like want to advertise their events through the IAS goodie bag, are they going to be goodie bags where people can input their things? How do they do that to promote their sessions, whether side events or networking zone events? How do they do that?
So we decided for sustainability purposes not to have a bag with bag inserts. There's a virtual bag for what it's worth on the virtual platform. But I think most importantly, if you do have side events during the, not during the conference hours, because we obviously would like not to have activities during the conference hours, but if you're organizing anything, there is the affiliated events system whereby you can send with a small form, you describe your event, it gets reviewed, and then it gets posted on our website, and it's affiliated with the AIDS conference. So if you do have an event, I encourage you to apply to the affiliated events page, and you will be able also to use our logo to show that you're affiliated with our main conference.
You're affiliated to the great. Thank you so much. Thank you so much, Erin, for your time. Yes, Betty, the virtual conference is also paid for at a discounted price. So I think if you go to the website, you'll see the different price breakdown and the prices according to the country you're from. And so you will then get to see how much you get to pay for the virtual conference. But thank you so much for your time, Arian. And we are excited about Canada. And I'm hoping that I will see many of those that have attended the session at the conference, those who got scholarships and those who are going to be sponsoring personally from their organizations. I'm going to be going, so look out for me at the the people living with HIV networking zone. I'll be there. But thank you so much for your time. Let me give it to Alan. Alan, before we close, please let us know about what are the plans for those, especially those who will be attending virtually, because there's some people who are asking, do I need to pay to attend virtually? But I know you are offering another solution for those who can afford to pay. So please let us know what is Y Plus and the 3 networks of people living with HIV offering to those that can afford to pay for the conference.
Thank you so much, Leseho, and thank you for this. Y Plus Global, ICW, and GNP Plus, in collaboration, are organizing a virtual event called the Hubs. So literally what happens is you're going to be in country. We are going to organize hubs in different cities, but not all over the globe. It's just 6 countries that we are going to be selecting, and that's where the hubs are going to be, in those 6 different cities. So people will meet at a specific place and follow the program and follow the agenda as what is happening at AIDS2022 in Montreal if you're not able to be there. The exciting part is you'll have the feel of the conference, you'll have the feel of people around you, you'll have the capacity to interact with one another, you'll have sessions to ask each other questions, and if possible, you can also feed into the live conference through the Y Plus Global podcast. So that is an opportunity that you should take and be excited about it. Yes, Leseho.
Yeah. And what are the countries? What are the 6 countries that you have chosen to host these hubs?
So for now, we have not completely finalized the list, but the intended countries are 1, Lebanon. The second country is, it is a decision between India and Nepal. There is Zimbabwe, there's Nigeria, there's Kenya, there's Eswatini, there is Zambia, and so most of them are in the ESA region, and some of them are in the MENA and the Asia Pacific region. So those are the few that have been under discussion.
Under discussion, great. So we will definitely be keeping people posted around when the hubs have been decided on, to say where is it going to be, the venue, and how you can participate. I know that Alan, there's also going to be a team of media champions or social media people that are going to be keeping us updated with the conference. What's about that? Tell me more.
So if I were attending the conference virtually, I would look out to the Y Plus Global page, the Twitter page. I would be looking out for the ICW Twitter page. I would also be looking out to the GNP Plus Twitter page. And this is why. The reason is we are going to be having social media champions, and they're going to be updating us on what exactly is happening in person, in country at the hubs. They're going to be posting the different sessions that are happening, the different views of the different people who are going to be there. And also, in addition, we are going to be having a guideline that is going to guide how these hubs are made. So ideally, it is going to be accessible to everyone. Please keep looking out to our websites and our social media pages. This guideline is going to help us be able to also organize our own hubs in the different countries where we may not be able to be, where Y Plus Global is not able to be, where GNP Plus is not able to be, where ICW is not going to be. You can lead that and organize using that particular guide. So look out for that, and we'll start having fun from the virtual conference as well.
Amazing, I love it. So you don't have to be able to register for the, not that don't register if you have the means to, but if you don't, there's hubs that are going to be available, and these spaces are going to be free for all to attend if it's happening in your country. So please do look out for that, and the guide will help you organize your own hub in your own country so that your community can be involved. And just so that I can let you in on this special event, so GNP Plus, not GNP Plus, but there's I don't know if you are a conference attendee, you know the famous no pence, no party. What is it? No pence,
no pence, no problem.
No pence, no problem party is happening again this year in Montreal, and this will be the last party for the no pence, no problem. After this one, there won't be any more. So make sure that you attend. The information is already out there on our social media, so that you can purchase your tickets if you're attending in person. And there will be a virtual party that's hosted, but this one is for the one that is in person in Montreal. Please do join us there. And also at our networking zone as GNP Plus and ICW and Y Plus, we will be hosting a gala to celebrate on the 1st of August. So if you're there, also watch out for that. But other than that, thank you so much for coming. I don't know if we have one more question. Why not Namibia as well? Francis, the guide will help you organize a hub in Namibia. So definitely get in touch with Y Plus, and they will help you organize that hub in Namibia. We would love to have a hub in Namibia. So yes. Samantha?
Yes, hi. I just needed to verify that there were no participants, no Arabic speakers today.
Okay, there were not.
I asked in the chat because nobody.
You asked in the chat. Whether did we have? Yeah, let me just check. Did we have any Arabic speaking people in the group that were listening in? No, I did see people who registered, but it means that they didn't make it. But thank you so much anyway, Samantha.
Okay, thank you.
A trooper.
Of course, always.
Yeah.
Thank you.
Okay, great. I think that's it for today. Thank you so much for attending, and we're looking forward to seeing you at our next session, which is going to be in July on the, what's the date? Clint will put it on the chat, the date of the next session, but we will share it again on our social media so that you can attend that session, which will be focusing on advocacy messaging that we're taking to the AIDS conference. Also to mention that there will be a Montreal manifesto that we will be supporting. So we will be telling you more about that as well. So please do join us when the time comes. Thank you so much for attending. Goodbye.
Thank you. Bye-bye.
Bye. Thank you very much. Bye.
Thank you, Ariane, for your time and for sharing with us all that information about the conference. I think it made get ourselves at ease, and we know now what to expect and how to go about it. So thank you so much for that. And we're looking forward to seeing you in Montreal.
Me too. Bye.
Thank you.